Lot of seniority I have over her. And commend our freshman colleagues because, and I appreciate very much the patience of the entire committee as we've had this most serious debate, which I know will be an ongoing one. But I'm here this evening to respectfully offer an amendment to preserve two very important aspects of the healthcare reform law: the ban on gender rating and the prohibition on insurance discrimination for so-called pre-existing conditions, which can include a history of domestic violence, a previous or current pregnancy, or C-section in childbirth. I offer this amendment because some of the most egregious insurance industry practices disproportionately impact women, and repeal of healthcare reform would again allow insurance companies to unfairly discriminate against women. I want to start with the story, as so many of us have, with one of my former colleagues told a group of us when we were debating health care reform last year. Prior to being elected to Congress, she owned and learned when she moved to hire a woman to join her growing company that because of gender, doing so would increase the health care premiums for all of her employees. This was bad in and of itself, but it had a compounding effect. The next time she looked to make a hire, she found herself thinking twice about hiring a woman. She, a woman business owner, thinking twice about hiring a woman, knowing her health insurance costs of that new employee would adversely impact the entire company. This story aptly illustrates the manner in which our healthcare system fails women both through outright discrimination and its more insidious consequences. One can only imagine how many women have not been offered jobs because of the influence of gender rating. Repeal would once again allow insurance companies to continue this practice in which a woman will on average pay up to 48% more than a man her age for the same coverage. And what's more, 79% of women with an individual market policy do not even have any maternity coverage. In fact, one of my Republican colleagues on the Budget Committee shared with the committee that his wife was dropped from their health care coverage when she became pregnant. While he was fortunate to have the financial means to be able to afford her medical care out of pocket, not all Americans are so able to do so. Women are also discriminated against when insurance companies deny coverage based on pre-existing conditions. In 8 states in the District of Columbia, before health care reform was passed, it was legal for an insurance company to deny coverage to a woman because she had been a victim of domestic violence, treating her victim status as a pre-existing condition. Insurers denied coverage to these women, assuming that they would be victims again and would need medical care as a consequence. This is not a problem in my home state of Massachusetts, where this practice has been banned for some time. However, in too many parts of the country, it is still allowed. For example, in Santa Cruz, California, a woman was repeatedly turned down for health insurance following a review of her medical records that detailed physical abuse by her husband. A woman's shelter in Rochester, Minnesota, was told that its employees were considered uninsurable because most of them were survivors of domestic violence. An informal 1994 survey conducted by the Senate Judiciary Committee found that 8 of the 16 largest U.S. insurers admitted using domestic violence as a factor in deciding whether to offer insurance coverage and how much to charge. These practices were explicitly banned by healthcare reform, and repeal of reform will allow this injustice to continue. I respectfully request that this amendment be made in order to preserve the ban on gender rating and the prohibition on insurance practices that discriminate so egregiously against women. Thank you.
Thank you very much, Ms. Tsongas. Next is, according to my list,
No, now it's Miss.